I'm gonna record to my computer, hopefully. All right, looks like it's recording. Okay. Hello, everybody, and welcome to the student panel. My name is Sachita, and I'm going to get us started. I'm the moderator for today. And again, as I said before, let me know if you have any questions. Just either raise your hand or just unmute yourself and begin talking. There will be lots of time for question and answers in the end. So please hold your bigger, longer questions for the end. If there's more technical questions, more urgent questions that you want my or somebody else's attention for, go ahead and unmute yourself. Okay, so we're going to get started with a little bit of introduction about the PhD clinical psychology. Sorry, still keeping an eye on the waiting room. Sorry about that. We are going to start by talking a little bit about the PhD clinical psychology track of PAU. Um, and then, okay, here's the event. We're gonna start with that. We're gonna give a quick introduction about everybody who is a panelist here today. I can't see all of you folks, so you'll just have to popcorn to each other or just begin speaking. And then we will have a guided questions round. I've prepared some questions that I think would be appropriate for everybody here. So we're going to start with that and then finish up with Q&A with the audience. Anyone who wants to ask questions, you can put it in the chat, raise your hand, start speaking, all of that fun stuff, or you can reach out to us after the end of the session directly and then ask your personal questions there. Um, all right, so does anyone want to get started on the intro for our program? If not, I can take over, but I'd really appreciate if someone else spoke because I'm going to be speaking a lot today. And please introduce yourself as much as possible. Anyone at all from PAU? Okay, maybe not. There might not be a whole lot of us, so it's all right. Um, all right, and feel free to jump in as I'm speaking, anyone from PAU too, to continue this discussion. So you probably have already checked out our website and know what we're all about if you're here today. Um, and okay, yeah. So focusing on the clinical psychology program, it's usually a 5 to 6 year long program, really depending on the kind of emphasis that you go for or the kind of work that you get done in terms of your dissertation during your years here. Um, you get set up to do internships and practicums through PAU. A little bit about us that's on the website that's more robust with like statistics and figures. Um, we 90% of our doctoral students accept a new postdoc, residency, or other training positions at graduation, which is quite a lot. And 97% of us secure internships at APA accredited sites. So if that's the goal for you, if the goal is practicum, internship, stuff like that, then PU is a great place for you to seek out and join. Other than that, we have great classes. So that's one of our emphasis in PAU is we are research based, yes, as any doctorate program is, but we are very, very curriculum based. We have a lot of classes. Cassidy can vouch for this, especially in our first year. Cassidy is our first year rep. Do you want to speak more about
Yeah.
the classes?
Okay. So I'm Cassidy. I am a first year in the PhD program. And as she was saying, you will take a lot of classes your first year. They're all very interesting, and you get a general kind of core cover of everything psychology. So you'll take child classes, you'll take adult classes, you'll take classes on psychopathology and psychodiagnosis, where we have to learn this lovely book. Forensics, ethics, like you're going to take a large number of classes. You get to meet a lot of professors, which is super helpful for the lab match process that will happen second year. But yeah, you will take a lot of courses at PAU your first year.
Yes. Yes, you will. That was perfect. Thank you so much. And the other thing that Cassidy kind of touched on is unlike a traditional doctorate program, we don't get matched into labs as soon as you enter. You enter, you take your classes for a couple quarters, and then you decide on which lab you want to go to, depending on the faculty member that you've had a chance to really talk to and get to know. So that's a little bit different. That's probably my favorite part about PAU. is getting to know these folks before I sign on to work with them for the next couple of years, especially on something as big as a dissertation. So what you do is as soon as you come in, you do get assigned an advisor, which works quite similar to a lab advisor, except they only kind of advise you about classes because you're not starting with research as soon as you enter. You can choose to, couple weeks or months after you enter, but that's not a requirement. And then slowly you make your way through the faculty, whether it's through classes or you reaching out to them personally. And then you decide on whose lab you really want to join and work with. Not to mention, there's a lot of cross labs collaborations. So you have a chance to work with a lot of different types of faculty members that we have at PAU, a lot of whom do work at Stanford too. So that's a really nice crossover there. You have labs at Stanford too that you wish you can apply to. So that's really fun. The other thing that I always try to talk about when I talk about PAU is right now we're going through the BAPIC process. If you don't know, if you don't know about that, a little bit about that is it's practicum that Bay Area doctorate intern students have to sort of go through where you intern it at different sites. And what happens with that is usually in other traditional doctorate programs in the Bay Area, you sort of get to make your own picks and go to wherever you wish to go to, apply all of that stuff. In Palo Alto, you get guided by your advisors, by folks who are in your clinical team. There are a couple folks there who are experts in this field. Not to mention, PAU has a direct and personal relationship with a lot of these internships. So what happens is some of these internships seek out exclusively to PAU to make connections with us and our students. So that's a great opportunity that not a lot of students outside of PAU are afforded, which is great. As soon as you join school, there are, as Cassidy mentioned, there are a lot of courseworks that you have to get to, and then you start applying for external practicums in year two. However, there is an opportunity for you to apply to a kind of an external practicum in or year three. Sorry, BAPIC is year three. In year two, there's an opportunity for you to apply to an external practicum here too, as a person who works at Kaiser right now. So you either apply and get into one of the clinics at PAU. We have a general clinic and two specialty clinics. One is a Clinica Latina, who focuses on Spanish speaking majority, and then the other one focuses on the LGBTQ plus community. So you either get accepted into these clinics or you can take a shot at applying to Kaiser, which is we have a relationship with the Kaiser Milpitas branch. Really lovely place. I'm working at right now, and that also opens up the possibility for you to get accepted into hospital settings when you apply to external practicums from year three or other Kaiser settings if that is your wish. That's more of an overview from a person. I am in my second year right now, so that's an overview of what I've done so far. Is there still trying to see? I can't see everyone. Is there anyone from PAU who is an upper year?
Yes,
Yes,
I might follow
please.
up. So, hello everyone. My name is Joey Yun Jiang, and I'm a third year PhD student in the clinical psychology at PAU. So currently, today I serve as a senior clinical manager at the clinic at PAU. This is my role. So, the clinic where I just provide some support, clinical operations, and to help ensure the quality of the care. And this role has just given me both clinical and leadership experience. So this is the clinic that we are just formally talking about as the Granovsky Center. It is also named as the clinic at PAU, and all of the students who admitted into the university will have their practicum in the second year in the clinic at PAU, especially someone else who has been admitted to the Kaiser program. And yes, speaking for the lab, I'm also part of the RISE lab, where my research focuses on the relationship structures, identities, and mental health, particularly with the LGBTQ plus and diverse populations. I think I choose PAU because of its strong emphasis, both are not only for the research based and also for the clinical training combined with all of them. And it's very supportive mentorship, the environment. Yes, and maybe a fun fact about me is that I'm originally come from Shanghai and have studied and lived in multiple countries, which is deeply like shaped my interest in cultural and identity informed clinical work. That is so far me.
Sounds good. Thank you very, very much for that introduction. Yeah, let's get to introductions too for the rest of us who are PAU folks. Before that, I just wanted to clarify, there might be questions about areas of emphasis, so I just wanted to make sure that I go through them quite briefly. By briefly, I'm just going to name the emphasis, and if there are direct questions about it, please ask. We have some tracks that show up as emphasis on your transcript, and you have to take classes accordingly if you want to emphasize in any of these tracks. If not, you can be a generalist too. That is okay. Some of our emphasis, we have trauma, forensics, um, sorry, peds, health, community-based. Am I missing anything? LGBTQ plus emphasis. Uh,
Psychology,
sorry?
neuropsychology.
Neuro. Yes, you're right. So these are some of our emphasis that you all can just take classes on and have that as a part of your PAU journey. Really fun to take classes on them, and we have some experts in the field who truly experts in the field who are teaching the classes pertaining to these emphasis. Okay. So before we get started on questions and answers, let's get all PAU folks to introduce themselves. I'm gonna drop that in the chat. Let me see what we want as a part of your introduction. All right, so I can start with myself. My name is Sachita. I'm a second year student, as I mentioned. Here we go. I am in Dr. Claire's lab, which is the Substance Use and Intergenerational Trauma Lab. Super fun. I have decided on doing the trauma area of emphasis. I'm still thinking about the community mental health area of emphasis. Not quite sure about it yet. Um, I am very, very interested in working with older adults and serious mental illness as it pertains to older adults, mostly anxiety, trauma, depression, and grief. And then a quick fun fact. I should have. Okay, that's the one part I don't prep for. A quick fun fact about me is my dad, he works in the UN, so we have had a privilege of traveling around to a lot of different countries. And my favorite one that I ever lived at was the Philippines. We lived in Manila, so that was really fun. Why I chose PAU, I genuinely chose because the idea of applying to a lab after getting to know the professor appealed to me more than anything else. There's only so much you can know about someone through their website or from one meeting. So it was very daunting when I was applying to doctorate programs to apply to a person, basically. So I thought PAU afforded the luxury for me to take some time and get to really know the advisor that I'm going for, because they do determine the kind of dissertation that I write and the kind of guidance that I receive in my doctorate journey. I'm glad I did that. I really, really enjoy the lab that I'm in, and I really, really um, have a lot of fun collaborating with my advisor right now. Okay, that was about me. Please feel free to just unmute yourself and then go on with your introductions. Thanks.
Perfect. Okay, I'm Cassidy again. I am from the Bay Area originally. I'm from Oakland. I did my undergrad in Maine and then I came back for grad school. Because I'm a first year, I don't have a lab yet, but I'm most interested in labs that are about aging or neurodegenerative disorders or brain injuries. I'm thinking about doing the neuropsych track, but I'm debating if I want the extra year because those on the neuropsych track, unless you're really, really rigorous, you're probably going to complete it in 6 years. And for labs, I'm interested in a few external labs, which is a really exciting part of PAU. And then my top choice for clinics is Kaiser. So I picked PAU because I really liked its connection to a lot of other things like Kaiser, Stanford, UCSF. You just have so many more resources than just one university. I also really liked the fact that I could wait a year, meet a bunch of professors, figure out who meshed well with the style of mentor that I would want and the type of research I would want. So I thought that that was a really huge pro. Um, a fun fact about me, I don't know. I've been scuba certified since I was 13, so I really like anything water related, anything outdoors, and I really like being back in the Bay Area, and I think PAU is an awesome place.
Yeah, I can add some because I have already said my emphasis and my research interest. Maybe some of the reason that I choose PAU because primarily, as I said, it's very strongly both combination of research and the clinical training model. So one thing that stood up to me is how early students begin seeing the clients and gaining the real clinical experience here. So, for example, second year students just get into the Granowski Center, the clinic at the PAU. And this helped me to build some confidence and the practical skills early in my training. And obviously, we're not getting any like the seeing clients at first year because we need to finish so many of the clients and we need to be responsible for the clients. We don't let some to see at first year students, but it will be very good to see them at the second year. And another important fact was the mentorship. I would mention it because that the faculty here are very accessible and supportive, especially in helping the students to integrate the clinical work and also the research part. So over time, I was found that PAU provides like the leadership opportunities as here, for example, my current role as the senior clinical manager and as when I was the second year student, I was just the clinical manager who, if you are going to in the clinic at the PAU, you are going to have a lot of interaction with the clinical managers. So this kind of role allows me to grow not only as a clinician, but also like a future leader in the mental health area. So that, yeah, overall, like PAU just helped me develop both the clinical research and also the competence and the professional identity.
That's perfect. Thank you. One last call for anyone PAU? I don't think so. Okay, never mind. All right, so that is all of us, and you get to ask all of us questions. Before we move on to for you guys to ask us questions, I have prepared some questions that I think are important for you to really know the answers to, and I want all of us as much as we can to give a shot on answering that. Cassidy, myself, and Joey. Let's see. So the first question, and I'm gonna put it in the chat for folks who've missed it. First question is, what is the process for matching PhD students with faculty members? Anyone want to take that question?
I can start. I haven't finished the process yet, but the beginning of the process is narrowing down your interests and making connections. So all the labs are posted online. You're able to look at the labs, learn a little bit more about the professors, what research they do. And whenever you feel ready to, you kind of just start meeting those professors. Maybe you try to purposely take a class with them, see if you like them. Or you meet a TA who happens to mention that they're in their lab. Note their name down. You'll connect with that person later. It's really helpful to get the student feedback. And you narrow it down to a few labs that you're interested in. I think you're only allowed to apply to 5 labs. The application process happens in late March. And yeah, so you get to apply to these labs, and then from there, they kind of make this decision of how many students are they taking. It's anywhere from 1 to 3, maybe 4 if they really need students. But for the most part, it's about 2 to 3 students that they take. And it's this game that you kind of have to play a little bit of who am I interested in, but who is also interested in me. So you definitely want to put your best foot forward, show that you're a strong student, show that you're enthusiastic about their lab with like genuine passion. Don't just apply to random labs, like truly apply to something that's going to be exciting for you. You're going to be doing it for 4 years. So make sure it's research that like gets you really excited and gets you going.
Yes. Do you want to add to it, Joey?
Yeah, because I'm a third year, I was like, the process is not very as clear as memorable to me, but as Cassidy say, I think pretty much this is the process. And one recommendation I would say that is like, you don't need to be perfect to add up or apply for a lab. You just show your authenticity and show your genuine interest in this research area. And then just trying to ask, like sending emails, like, can I attend some of the lab meetings and to see if it's a good fit for you with the lab collaborators and the professors. And then you can make a decision there. And even sometimes you don't like match with some of the lab, then you choose another one. The faculties are so warm and welcome, and you can also choose them or advise them to be your PhD dissertation faculty admission members. And then they will give you fantastic ideas and support throughout the whole year.
Yeah, the student reps also host a lab match meeting where students from each lab volunteer to give some of their time to first years, and we all show up and you just get to have like a candid conversation with people actively in labs, learn a little bit more about the lab, which is really awesome. Gives you a chance to see a different perspective.
Yes, that's true. And Cassidy and I both are student reps. She is the rep for year one. I'm the rep for year two. So we are organizing the lab fair this year. It's in 2 weeks. So that's forgot about that. But it's gonna be great. The other thing about labs is everybody gets chosen to a lab. There is not a person who doesn't have a lab. So you go through round one of trying to choose a lab, and if you don't match with anyone, that's okay because after that, um, the clinical team gets together and decides which lab would be beneficial for you, and they reach out to you and ask for your choice in that matter. So everybody gets assigned to a lab. There's not a person who doesn't get assigned to a lab. That's very important to writing your dissertation, which is again important to becoming a doctor. So that's that. All right. Question two. Put that in the chat. Um, Okay, so what types of practicum placements are available in the first 2 years? Are there opportunities for bilingual or culturally specific training experiences? Cassidy, you want to take that?
Yeah, I for first year, there's not practicum placements available. You're really just applying to practicum placements, which you have a plethora of options to. First year, it's all about courses. So you start by taking a ton of courses. You learn how to work with clients. Right now, I'm taking clinical interviewing, where we practice working with patients. And then starting in the summer, you start depending on which clinics you've applied to. So if you don't apply to any, you're just in the general clinic, which is any person who self-selects the general clinic. If you apply to either of our specialty clinics, you could be working with Clinica Latina or the SGIC, which is our like sexuality, gender diverse trans clinic. And then there's also Kaiser, where 10 students can be placed at like a hospital setting in Kaiser. So depending on your interest, it's pretty easy to find a good placement. I'd say Kaiser is the hardest to get into just because there's a set number of students, but for some of our specialty clinics, they always have clients who need therapists. So the more the merrier. Clinica Latina allows for bilingualism within your therapy, so you can be working in Spanish, but they've also recently opened it up so that you don't have to work in Spanish because there are a lot of Latin patients who don't necessarily speak Spanish as their primary language, but still are facing a lot of the issues that are happening right now, such as ICE and just what's going on politically in the world. And then with our queer clinic, you can be working with individuals, you can be working with couples, you could be working with people at any stage of their identity. So maybe they're just coming out, or maybe they have an established identity for the last 20 years and they just want a therapist who understands them a little better. So I really value that there's so many options and you can really pick if you want to work generally, if you have a specialty, if you want to work in a hospital, like neurology kind of setting with Kaiser. But yeah, maybe somebody else who's been in the clinics can jump in a little more.
Yeah, I would say that, yeah, pretty much for the practicum places. And then, about the opportunities for the bilingual or the cultural specific training experiences, I know that we are offering some pretty much cultural community trainings here, and especially not only for the Latina Spanish speakings and also for the Mandarin speaking. I also heard that some of the plans that going to open a clinic that is specific for Mandarin speaking, but I'm not sure like 100%. But I would be very happy to connect with anyone who share my experience doing like the clinical work as English as a second language. So my experience is hasn't been like language can initially feel like a barrier, but clinically presence and attunement and the ongoing professional growth are like far more central to the effective therapy. And over time that I just found that deepening the clinical skills and engaging fully into the supervision and the training naturally will strengthen my confidence and ability to work across language and cultures. So, and also there are so many different kinds of training provided for bilingual and cultural trainings. for example, in our supervision group, there is at least like 1 or 2 sessions that is focused on the cultural differences training in the placement. And also, I know that we have a cultural specific like language or Mandarin speaking training session or like a course in the part. And then I was invited as a guest lecture speaker for that. And anyone interested in that, you can attend to that. And maybe there are a lot of training in the clinical Latina, but I'm not part of that, so not very sure about that. But anyone can add that if you are a part of the clinical Latina. And Dr. Revelle is just really fantastic. I've talked to her. She has so many experience with training with the bilingual and the cultural differences. So yeah, that's all for now.
Yes. Thank you very much. I personally don't work in the clinics because I do work at Kaiser, so I don't know too much about the clinics. What I know is from secondhand experience from my friends. They all have great things to say about the clinics, especially the specialty clinics. Um, the one thing that you don't get in Kaiser is couples or families. So you don't get to work with couples or families, but in the clinics you do. So that's something, if that's your thing, then the clinics is where you should be applying to. I have one last question for all of us, but I think I'm going to reserve that until the very end because I want to stay mindful of the time and give you guys an opportunity to ask questions. I already see some coming through the chat, so I'm going to read them out and see which one of us picks that up. So one of the questions is if we could talk about how we are able to fund our graduate studies here at PAU. Yes, very, very expensive. And if there are assistantships with tuition remission available, or if how common it is for students to get these, if any. Um, to that end, yes, PAU's expensive, and funding education is not easy. We do not have full tuition remission, unfortunately, as a part of PAU. If you come in with a scholarship already embedded into your application, you would find out through PAU before. If not, there are no full tuition remission scholarships once you join. There are scholarships that you have available after you join, and you can apply for those. However, it's not guaranteed to every single one who applies. The way that I personally fund my studies or part of my studies is through on-campus employment opportunities. Cassidy and I are both student representatives, as I said before. That is an employment opportunity through PAU, so we get paid to be student representatives. I think that is through Cassidy's student assistantship
Yeah.
position.
So I
Yeah.
was initially hired as a student assistant, so now I have two roles through PAU. They have a lot of employment opportunities for students, which is awesome. You could also be a TA for other programs, so like for the undergrad or the MS program, and then once you're a second year or above, you could TA for first year PhD classes or any classes that you've taken. So there are a lot of employment opportunities that can help you.
Yes, absolutely. I think TA-ship is the most popular one. Yes, Joey wanted to speak.
Yes, just to add some, as far as I know, if you have a master degree as well, you can also teach students for the undergraduate, and that's pay a lot. And as I'm an international student, so I'm limited to work for 20 hours a week here. But actually, it's good for like working as a CM manager, and I got paid for that, and then for TAs, and then sometimes you are inviting for lectures and all of the things, and then you just got so many opportunities to work, and then you got pay for that. So that is very good.
Yes, it's very good. I'm also an international student, so I am also limited to 20 hours a week on campus, and I hold two positions right now. One of them is a student representative, and the other one is a student assistant, where I work with the Office of Faculty Success. I work with the grants office, and then I work with the Center for Education Excellence. These are the three offices and interdepartment work that I do outside of student rep, and I also work very closely with the president on a task force. So there are just, since it's a very small school, you get to sort of know a lot of people throughout it, and so you get little opportunities like that everywhere where you look. Around commencement time, I know they're always looking for student volunteers to work with, so there's stuff like that. Other than that, there is an on-campus free food pantry that PAU provides for folks who come on campus, which is typically first years or second year students, sometimes third years when they are still taking classes. Here you just come in, you go to the kitchen, and you sort of pick out the food that you want and then just take it for yourself. It helps with some of the food insecurity that everybody in the world seems like they're experiencing. Um, and then there is a very small new sort of scholarship that they've started for folks with just who want to ask for a little extra help through the school. You just kind of apply for it. As far as I know, everybody who applies for it gets the scholarship. So there's that. There's other scholarship opportunities that you actively have to apply for, that the financial department has more idea about. Let's move on to one question from a person. I think Connor raised their hand first, and then we'll move to another question from the chat.
Yeah, thank you so much. I just over like a general question for any of the first year students, I believe Cassidy. Wondering if you could just describe like your semester in like out in numbers, like how many hours you worked total, like nights, weekends, after dinner, like what was your first semester's course load like?
Yeah.
And like so far, like into your second semester, what does that look like? Because I think that's been the million-dollar question for me. I tried to get that answered and I didn't really get that in one of the previous sessions, but
Yeah.
definitely curious what the workload is like. And obviously that's going to be varied among people because people have different workflows, but yeah, just curious in
That's a
that.
great question. So first quarter, you will take a crazy number of classes. I think it's like 6 to 8 at a time, depending. There's some half classes, but you're taking a lot of classes. They only meet once a week, so it's less scary than it sounds. Some of them are really long. So like statistics is from 1 p.m. to 5:50. So that might be the longest class that some people have ever experienced. But a good thing about that class is half of it at the end, or 2 hours at the end, is a TA time where they go over the homework with you, and it's optional to leave or stay. If you leave, you have 2 extra hours of your day. If you stay, they teach you every step of the homework, and then you can just easily submit it. So you're not spending much time outside of class for that class. But first quarter, it is a rigorous low. You will be doing a lot of homework. I would not recommend trying to work a bunch of jobs your first quarter as well. There's just so much that you have to do. You have to make sure that you're on top of all your classes. You're also in a new place for most people and you're trying to meet a bunch of people. So there's definitely kind of a little bump of trying to figure out how to balance a social life and an academic life. I would say it took me a few weeks to catch on, and with the quarter system, that's almost the entire quarter. So it's a little rocky at first, but now at second semester or second quarter, I'm taking 5 classes. It feels like a way lighter load. I'm definitely in the flow of things. Homework takes me 2 hours maximum for each class, so it's really not too much after classes. It's really important to learn which classes you really have to do all the readings for and which ones you maybe don't. Because there will be classes that will show you a crazy reading list and then never ask you about it again, never quiz you on it, never talk about it in class. And you can kind of start to filter out, okay, maybe I can skim those readings versus this class, you really have to be rigorous about reading every paragraph. So there's a bit of a hump of just figuring out what is crucial and what is not. You will be spending a lot of time in classes, so set yourself up for success there. Don't overbook your schedule and panic. But yeah, it gets easier as the quarters go on as well. That's a good question.
Yes,
Yeah,
perfect.
just to add something to alleviate the stress. I'm a third year and I'm only have one class for a quarter. And then just because that I have to remain my visa application status, so I have one class. I already finished all of the class in the first and second year. So actually I don't need to take any class in the third year. And then just practice and in the practicum exercise, and then just for the clinical work, I'm in a meeting now. So yeah, that's all you need to know. And as far as I know, for like the first year, like 7 classes, and then 7, 6, 5, 4, and then for the second year, it might be just a little bit about like 4 classes for a quarter. So you just being more familiar with the class settings, and then you got more sufficient of the classes and quickly finish the homeworks.
Yes, agreed. I'm in my second year right now. I'm taking 3 classes currently, and I'm working for 16 hours a week at Practicum and 20 hours a week with my various jobs. In doing so, I do have to work over the weekends and I do have to work after dinner, all of that stuff. But on-campus employment is a choice. Outside of that, you have to do the other stuff. So I would say get ready to do a lot more work than you would have done maybe in undergrad, maybe in a master's degree. I don't know. I personally don't have a master's degree, so I don't know how that works, but it is a lot of classes in your first year. Few more classes in your second year, and then from your third year, academics, pressure goes a little bit down, and then your practicum pressure starts amping up. The other thing about classes is first year you get midterms and quizzes and all of these exams and all of this that stuff that kind of stops from second year. So at least you don't have to worry about exams or pop quizzes. I also want to stay mindful of time. It looks like we won't get through all of the questions. I'm so sorry. I know five of you have raised your hands. I want to get, what should I do? All right. I know I got a question like 10 minutes ago, so I'm going to address this from the chat real quick, and then I'm going to get to as many as possible, okay? So in terms of resources available for PhD students to conduct clinical research, what is your perspective on access to these resources as a current student? Great question. I think that really, really depends on the lab that you're selected in. Some of the labs come with huge, like huge data sets that the professors have been working on for ages, and you get access to that, you get to work with that. And some of these labs, they are more flexible about that, where you can conduct your own research. The best part about this is, as far as I know, all of your lab advisors, whichever lab you get sorted in, they are with you every step of the way, and they really guide you in terms of data, in terms of resources, in terms of kickstarting your own research, research project, research interest, all of that stuff. Not to mention, you have the opportunity to collaborate with institutions outside of PAU. Right now, I'm working with Kaiser on a paper. I'm working with Stanford on a paper. The more you immerse yourself in PAU, the more networking the bigger your network gets, and then the more opportunities for research is available for you. But yes, that really, really depends on the lab that you get into and your research interest. Um, all right, moving on. There's another question. How has your experience been in large cohort? Is there anything you would change about the program? Yes, to address the first question, I was a little having a large cohort. Our cohort had about 55 people, have about 55 people, I think. Huge for a doctor program, I know. So that was quite a shock when I first joined. Um, but you have different sections when it comes to classes, and then you do the professor to student ratio is quite good actually, although it looks like larger cohorts, and you only get to see everybody in your first year. From second, third year, you start panning out and you start taking smaller, more niche classes to satisfy your requirement for your emphasis. So it drops from like a 25 people class to like a 6 people or a 7 people class sometimes. It's quite a nice change, to be honest. I personally didn't mind the large cohort. I'm sure there are other perspectives or views on that. Do you have anything on it, Joey or Cassidy?
Yeah, so it's kind of like I don't have any perspectives or anything to change for that, but I do think that PAU has just offered as long as what the support for all of the students. For example, like for one-on-one counseling, and my first year advisor was Dr. Cordova, and we see like every opening beginning of the quarter and every ending of the quarter. And then now I'm in the lab, and then my lab just meeting like weekly, and then we have scheduled one-on-one sessions and counseling with Dr. Boson every week. So it's like very flexible. You got the opportunity to talk to your advisors and the professors, but it just depends. This is my personal experience. I'm not sure with like other labs or other members, but my feeling is like it is sufficient enough for me.
Yes. Perfect. I'm so sorry. I think we only have time for one last question. I'm gonna drop my email. I feel really bad. I'm gonna drop my email on the chat. Um, just feel free to email me with all the questions that are still on the chat, all the people whose hands have been raised. I'm gonna call on Annabelle real soon because I think you're the one who raised your hand the earliest. And then yeah, feel free to email me. Feel free to email Cassidy. She has also dropped her email. And then we'll connect later on that. I'm so sorry we can't answer everything. Wish it was longer, but yes, Annabelle, go.
Thank you so much, students, for organizing this and being here. I did have a different question, but I want to avoid any potential redundancy and be mindful of time too. It's great to hear multiple perspectives if possible, but I was wondering if you could just generally describe the culture among students in the program.
Yeah, perfect. Cassidy, do you want to take that? Since she's the
Love
first year, she's
to.
the
Yeah.
newest here, so.
Well, everyone has the same interests, which is really unique. I mean, most universities you show up and there's different majors all over, but here you're going to show up and every single person in your cohort is doing psychology. Now, there's still variation of what emphases you want, kids, adults, families, couples, whatnot, but everyone there is passionate and educated about the same thing, which I find really fun. Like, we have amazing class discussions because every single person there has taken the same prereq courses. Everyone knows a little bit about this stuff and your professors are really passionate. So that you show up to class and you have this big discussion about what possible diagnoses could happen for this fake case study we're giving you. What treatment would it be? And everyone's building off of each other and questioning each other and kind of just this really collaborative environment of smart, passionate, educated people. It's awesome.
Yes, absolutely. And I think one thing to mention with that is people's point of views. As I mentioned, I am someone who doesn't have a graduate degree before this. I didn't do my master's. There's so many folks who come in with a master's. There are folks who come in with PsyDs. There are folks who come in with like 10 plus years of clinical experience, and they have so much to talk about in terms of discussions and stuff like that. So that's a really, really wonderful part of PAU and the cohort that we have because it is so large. You get so many different types of people here. One thing for sure is everybody there belongs to be there. So that's something that was hammered onto us in quarter one is no place for imposter syndrome at all. You all are selected to be here because you belong to be here, and everybody there is passionate and smart and driven and eager and wanted. So that's that, if that.
Yeah. I would say it also is passed down from different cohorts. So like every TA I've had is the most helpful person ever. Like I can reach out to them about questions unrelated to class and they're happy to just give me their time. Like I've gone on like coffee hangouts with TAs, I go to clubs with other cohorts and everybody just wants to like foster community and help you in any way. I mean, people had to pave the road themselves, so it's kind of nice to pass it along and give people tips and advice. So it's just a really warm, like collaborative environment amongst students.
Yeah,
Absolutely.
I would add that the cultural humanity is one of the core clinical competency that you are going to be evaluated during the oral exam in the third year. And then that is perfectly not just only for treating you as a student or cohort. We just discuss the questions and everything and in a very safe and grounded and a privacy place. And everyone should just share their opinion and respect with others. And then just enjoy the atmosphere that's coming from different identities, ethnic backgrounds, and then we learned like the minority stress models. We learned everything about the cultures, and we even have a class about that. I think Dr. Chu is teaching that. Is that real, right? And that offers really so many bunch of like experience and knowledge about the cultural differences that we can so that is kind of like the opportunity that we can share and learn in the PAU.
Yes, absolutely. Well, thank you guys so much for your time. Thank you, Cassidy and Joey, for joining us and helping everybody with this. We're gonna let you guys go now. Again, please feel free to reach out to us via email and we can arrange something, maybe a meeting, maybe a phone call, maybe email back and forth. So sorry we couldn't get to all the questions. I feel awful. Maybe next time we should just stick with questions instead of everything else so we have more time. But thank you so much. Have a great rest of your evening.
Good one, bye.
Thank you.
Thank you.